My name's Olivia Connor, and I'm going to do a lung and chest assessment on my patient. First, I'll do hand hygiene, and then what is your name and date of birth?
Teresa Connor, 7/11/1968.
Do you know where you are today?
Yes, I'm at the clinic for a respiratory check.
Okay, thank you. So first, I'm going to look at her appearance to make sure she's relaxed. She has no forced breathing and no forced expirations, and she's breathing normally. Second, I'm going to look at her posture. She's relaxed, sitting upright, and she's alert and oriented ×4, so she's good to be by herself. Her effort of breathing, it's no nasal flaring or no pierced lips. She's breathing pretty regularly, and her skin color seems to be good, pink, and just has good color overall. Next, we're going to do an assessment of her chest wall just as an inspection. So her chest shape is symmetrical in size, and it's a cone shape, so up top and then it comes down lower, and it's also oval around. And then her muscle development is normal for her. She's not using any accessory muscles and is mostly breathing by her diaphragm. And then her AP to transverse diameter, so we're going to measure from here, and that's 2 by 1, so 1 to 2, which is in normal range. Next, we're going to check her costal angle, which is right below her xiphoid process, and we're going to come down and measure here to see the length across, and so that would be about 90 degrees, which is also in normal ranges. Next, we're going to do an oxygen and respiratory effort assessment. So first, we're going to look at her nails to make sure they're rounded. They are pink in color, and she also has a cap refo less than 3 seconds. And then next, we're going to look at her lips. They're moist, and they're also pink in color, so within normal ranges. Next, we're going to look at her respiratory rate. So I'm going to measure that for 30 seconds. Okay, so we take that and then we time it by 2, which is 20, which is within normal range, which is 12 to 20. And her quality of breathing seems pretty easy. She's not having any trouble breathing. She's very quiet breathing, and her pattern is regular and equal, so everything is in line there. Next, we're going to look at her chest expansion, which seems to be symmetric when she breathes in on her front and her back. It is symmetric when she breathes in and out. And then next we're going to palpate her trachea, so we just want to come down and find it and then make sure it's equal on both sides, which she seems to be good. So next we're going to palpate for an anterior and posterior chest assessment. So first we want to check her chest just to make sure, are you feeling any tenderness or anything?
No.
And then I feel no lesions, no lumps, no masses or bulges. So next we're going to check to make sure. Can you breathe in for me? And out. So that is equal, so can you turn to the side for me? Thank you. And then I'm going to have you breathe in and breathe out. And then everything is symmetric when she's taking her breaths. So the back wall expands with the breath taken in, and they are equal. My thumbs stay together on the front and the back. So next is what I'm going to do is auscultate for her thoracic lung sounds. So first I'm going to check her vestibular breath sounds, which is normally just like the normal regions where you would listen for breath sounds. So her breath sounds are normal, and these vestibular breath sounds are usually low in pitch and they're soft, so her sound within range. Next, we're going to do her brachiovestibular breath sounds, and so these are going to be checked like by the clavicle, sorry. So if you could just take a breath in. And also on the back. These are also within normal range with the pitch for what they are supposed to be. Next, we're going to do the bronchial breath sounds, which are usually loud and high in pitch, and they're usually tested up by your trachea. And those also sound within normal range.